Good afternoon, everybody, and welcome to CQC's webinar on local authority assurance and integrated care system oversight. Really nice to have you all joining us. So welcome. My name is Mandy Williams. I'm the Interim Director for Integration, Inequalities and Improvement, and I'll be running this session with my colleague Mary Cridge, who's the Director for Adult Social Care. And we'll be co-presenting. We're being joined by some colleagues from engagement and from policy and strategy today to help to support. So thanks for them to them for coming along as well. Just a couple of little ground rules. I hope you'll find this really useful and productive. Please bear with us if there is a technical glitch. These things happen, especially on very hot afternoons. We'll do our absolute best to stick to time. The way the webinar is set up means that only the webinar team are able to speak. So you'll see down the side there is a chat function. Please use this chat function on the side of the screen to ask any questions. It'd be really good to know who you are. So, you know, if you can put your name and where you work down the side, that would be really nice as well. So we know who's asking the question when you post it. We will only be answering questions that are related to the webinar topic today, but don't worry, all your feedback is recorded and taken into consideration, and we're building a frequently asked questions sort of Q&A sheet that will be accessible as well. The webinar is recorded and that will be uploaded onto our YouTube channel, so your colleagues can revisit it, and slides will be sent round to you after this event, together with the recording and some other useful resources. So with all that said, let's just move on, please, Steph, to the content. And next slide. So just a little bit of context that this webinar is to update you on the actions that we're taking, as I say, in relation to local authority assurance and integrated care system oversight assessment. And they come about as a result of the changes to the Health and Care Act. And they've given the three central aims of greater integration, accountability and a reduction in bureaucracy. So next slide, please, Steph. What does it mean for CQC? Well, these additional powers mean that for the first time we'll have a role in reviewing and assessing systems and not just providers. So we'll be looking at how systems are working in their entirety, in their totality, and looking at how local authorities are meeting their social care duties under Part 1 of the Care Act. Next slide, please. So it's a really big change for us to have gone from pure provider regulation to having the authority to oversee the systems and the local authorities. So in order to do that, we've really had a major change internally and have developed a new regulatory model. That's enabling us to change how we deliver regulation so that we can become a more effective regulator. So our regulation can be put more effective and timely. To support that, we've developed what's called the single assessment framework, and I'll just talk to that in a little moment. And that's going to enable us to really focus on how systems are improving outcomes for people, reducing inequalities in their care. Next slide, please. So this slide sets out what the single assessment framework looks like. So it will act as a golden thread that will run all the way through from individual providers all the way through to our assessments of systems and local authorities. It starts with the 5 key questions and they'll remain central to our approach. So that's safe, effective, caring, responsive and well led. However, they aren't applied to our assessments of integrated care systems and local authorities. but they will remain there in the single assessment framework. We've beneath this, the key questions sit what we're calling quality statements. We've drawn on work that's been done by other agencies and by people such as Think Local Act Personal, National Voices and the Coalition for Collaborative Care to really bring to life what those 5 key questions mean to people who work in services and who receive health and social care. Importantly, they set out what good and outstanding person-centred care looks like and what people should expect from their providers, from their commissioners and from the system leaders. And they're very much framed in the I and the we. So we wanted to use I statements as the starting point for our assessment framework so that we would take that first really important step of regulating through the eyes of the public. The statements encapsulate the views and expectations of real people, and we feel that giving them that prominent place in our single assessment framework will help to focus the whole health and social care system on what people really need. Quality statements, as I say, they're pitched at the level of good and they're linked to our regulations that will help us make those judgments about qualities of care. We've reduced our current key lines of inquiry and replaced them with the quality statements. Currently there are several hundred key lines of inquiry. They'll be replaced with far fewer quality statements and there will be prompts that sit underneath those and they're expressed as we statements. So they'll be helping to make things clearer for providers to understand what our expectation on them is, whilst reducing the duplication that currently exists around our key lines of inquiry. We'll use these sets of statements in our assessments of all sectors. So our key lines of inquiry, our key questions will sit running through all of our providers. Quality statements will be consistent across all areas, from our providers to our systems, and beneath those will sit the evidence that we gather. And we've looked at our evidence to identify that actually they fall into really 6 sort of key themes. We wanted to be more consistent and transparent in our approach around what evidence we're gathering and how we make those judgments to quality. So if we've developed a way to categorise and score that evidence as part of our assessment. And the initial, the evidence categories will bring far more structure to our process of assessing quality. So there are 6 categories for our evidence. There's people's experiences. We want to hear what it's really like to receive care, treatment, health or social care from providers. We're wanting to hear feedback from staff and leaders to find out what it's like to work in the organisations. We'll observe care. We'll receive feedback from partners, talking and sharing information and intelligence with others. We'll look at the processes that we'll use, and very importantly, we'll look at the outcomes of care received. In many ways, this will be data and evidence that's already familiar to providers and to our inspectors, but by bringing it together into the 6 categories and setting out what we always need to collect and to review in order to make a decision, alongside clear scoring evidence, will bring more structure and a consistent framework to assessing quality across all areas. Next slide, please. So how have we developed our approach? We've done a huge amount of collaborative working. We've talked to hundreds of people up and down the country to really understand what our questions should be, what our quality statements should be, how we should frame it. So we've done a lot of collaborative work. There's been a large amount of co-production and engagement, and all with a consistent aim that we add value and don't duplicate. Next slide, please. One of the things that we've heard through co-production is that sometimes there's a bit of confusion about the language that we've used. And so there was an ask that actually we are more consistent in the language, and that's really, really important. So we worked with an expert advisory group to define the 3 key elements of our approach. And for assessment, we're describing the whole process of measuring the quality of care and identifying risk. When we talk about inspection, we're talking about the actual physical activity that we undertake. And when we say assurance, that's describing the outcome we're all working towards. And the next slide, I think, hands over to Mary.
Okay, good afternoon all. Thank you, Mandy, for kicking us off. So next slide, please. So the local authority assessment is distinctive in that it is focused on the Care Act from 2014 and the responsibilities that local authorities have to the people who live in their areas. So it has got a social care focus, and it is all around prevention, information and advice, and the right services being available. So the sorts of services around prevention, this is like looking at how a local authority knows its population, can look ahead and see what services are needed that are focused on either keeping people well and active. So sort of the public health sort of angle comes into this as well. So to keep people as independent as possible for as long as possible. So either, preventing the need for care at all, or certainly delaying it for as long as possible. Really important duties around the provision of information and advice. Again, both about how to keep ourselves as citizens fit and well, and information about services that are available at that stage. And then as we come into later life or circumstances for working age adults that mean help and support is needed, that there is information and advice for people and their families to inform their decisions, not just about how they're leading their life, but about the services that are available to them. And then when it gets to the stage of actually needing a service, whether that is support in the home, in our homes, in our communities, or some form of residential service, then local authorities have a duty to make sure that there are an appropriate range of services for people to choose from, and that those services should be of good, high quality. So local authorities have a role and a responsibility for the market, the social care market in their neck of the woods. And in delivering all this, local authorities need to be working with their communities and other partners such as NHS partners to make sure that the services are fit for what local people need now and for the future. So really important Care Act duties. So if we could have the next slide, please. So this list here shows the initial focus that our assessments will have, building on and using the quality statements, the I and the we statements that Mandy has spoken to us about, but we've grouped them into 4 themes that sort of reflect both our framework and the duties that local authorities have under the Act. And here they are: working with people, providing support, ensuring safety and leadership and workforce. And our next slide, if we move on to that, shows the quality statements that sit under those 4 themes. So there'll be detail for all of these sitting underneath, but starting with working with people, in assessing needs of people, we're talking about the individual person requiring assessment, and also the role of the local authority to consider the whole sort of population, citizen, resident needs in their patch, and that whole, as I've touched on, sort of supporting people to live healthier lives. When it comes to providing support, we're looking at the provision of that care, and also how well that is integrated, and the continuity aspects, because obviously you need care that's going to be resilient and be around. So looking at partnerships and communities under this whole theme of providing support as well. Then when we get to ensuring safety, this is about the systems that the local authority has being fundamentally safe, designed to be safe, and safe in their operation, and also safety along a pathway and at transition points. So thinking about young people transitioning into adult services, thinking about people who've been in hospital transitioning to care at home, care in the community or residential setting. And also under this theme, we'll be looking at safeguarding and the role that a local authority has there. The fourth theme around leadership and workforce. So this is the leadership of the local authority itself, looking at how they are governed and managing themselves, how they are managing so that they're sustainable in their offer, and also looking at learning and improvement and innovation. And this theme really builds, as does the single assessment framework, on all that we've learnt in our business as regulators thus far, which is that leadership is absolutely key to safety and to the quality of services, and that if there isn't learning and improvement and innovation going on, then that's also not the sort of place where we see really safe and really good services. So the quality statement sitting under the four themes will be our approach to the local authority assessments. I will be back, but I'm going to hand you over to Mandy, reflecting on the approach to integrated care systems.
Thank you, Mary. So next slide, please. So this slide just sets out the core purpose of the integrated care systems. So they're very much to improve outcomes, a huge goal, improve the outcomes of people who are resident within the footprint of the ICS, to tackle unequal access, experience and outcomes, to make sure that there's a good productivity and value for money being delivered, and to support broader social and economic development. Next slide, please. The face of the Act sets out three key areas, that of leadership, integration and quality and safety. And those will be our initial focus for ICS assessments. So the legislation requires the Secretary of State for Health and Social Care to set objectives and priorities when it comes to assessment of integrated care systems. These three themes are on the face of the Act, and they'll be our initial priorities. So leadership, integration, quality and safety. These areas came through really, really strongly when we spoke to providers, stakeholders, people who use services, voluntary sector and local groups. And so as a result, we decided to make them the foundations of our approach. Quality and safety will be central to our approach to integrated care systems, as they are to how we regulate providers, to how they're meeting the health and care needs of people who use their services. But so too will be how those services are integrated together and how inequalities are being tackled. So when we looked at those three key themes, we looked at our quality statements that would map across. If we go on to the next slide, please. This slide sets out the key quality statements that sit within each of the three themes. So within leadership, that shared direction and culture. As Mary said, we really know that good, strong, effective leadership is really key to creating a really good learning culture. We want to be looking to how leaders are delivering their function in a compassionate and an inclusive way. Of course, we'll be looking at governance and assurance processes, but we also want to be really clear about how they're working as leaders in partnership with their local communities, how they're learning and improving, how they're considering environmental sustainability going forward, and really importantly, looking at the workforce equality and diversity amongst all of their workforce. The second theme of integration. Now with this, we'll be looking at how those safe systems of care are being delivered, what the pathways of care are like, and what those transitions are like between care providers. We'll be looking at the care provision that's delivered and how continuity carries on, and how staff, teams and services work together to the benefit of the residents of the ICS. And when we look at quality and safety, we'll be wanting to see that there's a really learning culture, and this links very much back into that leadership, compassionate, capable, inclusive leaders, and they're the ones who are going to be really promoting a good learning culture. We'll be looking at how they're supporting people to live healthier lives. One of the things that we've heard is the language that we use, that we need to be mindful of that language, that we don't refer to people as patients or service users when we're talking about those people who live within the integrated care system. The whole aim of that is about keeping people well, helping them to live healthier lives, helping to prevent them needing to access services, stopping them needing to become patients or service users in the first place. So how are those systems supporting people to live healthier lives wherever they may live? How are they ensuring that there's the right staff with the right skills and a good workforce stream coming on? Safeguarding is always a really, really important point. And then very much within quality and safety, looking at equity and access and equity and experience and outcomes. And we very much framed this with the word equity as opposed to addressing inequalities. It's very much about how services are being encouraged to address those inequalities, perhaps by doing other things for other groups of people, different things for different groups of people, to ensure that they get equity in their access and equity in their outcomes. I'm going to hand back to Mary now.
Thanks, Mandy. It's me again. So we've been talking to you about our single assessment framework on which we're building everything we do, from our registration, our provider regulation, and this work that we're talking to you about this afternoon. And we've looked at what those areas and the specific focus on them both. I'm now going to take us through the areas that are actually common to both areas of work. So if I could have the next slide, please. So the first element where we've got a lot in common is around evidence. And here's a list that I think will be familiar to many of you on the call. Absolutely central to both the systems and the local authority work will be evidence of people's experience directly from them, their families, their carers, also what the different organisations that make up that system and local authority, what they know about people's experience, but that will be absolutely at the heart of it. We shall want feedback from partners. So we'll have in this sort of folk feeding back on each other, but that's really important that we understand what it's like to be delivering in that system as a commissioner or a provider, and how that's all working, how people are working together, because doing that well is going to be so important. We shall want feedback from people working in these organisations and their leaders. Of course we will. And we will be undertaking observation. So looking at what's going on, observing things happening that will give us insight into how people, what's being provided, what the impact of it is, and how it's all fitting together. We'll also want to look at processes, understand how things are intended to work, so we can take a view on how they're working in practice. And we shall want information both about performance, but importantly about outcomes. What difference is the particular activity and work making, and how do we know? So really important that, and that is absolutely common to both local authority and systems work. And possible sources for all this could include case tracking, of course. We could look at staff surveys. We could look at what quality is like in that area in terms of the providers. If there are a lot of services in that area that are inadequate or requires improvement, what is the system? What are the local authority doing to address and support providers to improve? And of course, we'll have the generally available information, public health data on the population, on the equalities in that patch and the inequalities. What difference have we got in terms of experience based on people's protected characteristics? And all of that we'll be hoovering up and using both for local authority assessment and the system work. Next slide, please. So another thing the work has got in common is our proposed approach. So unlike provider regulation, which we've been doing for some years now, we don't have an established baseline of understanding of quality and safety. So we need to establish that baseline for the 40-something ICSs and the 150-something local authorities. We need to get round everybody and get that baseline established. And in line with the strategic direction that Mandy has described, we want to remove the distinction between monitoring, and assessment and move away from the idea of inspection being the only means of making judgments. So we're going to develop our approach of ongoing assessment of both quality and risk for this work. We're going to make use of all the available data sources. We won't be asking for anything new if that data already exists and we can get our hands on it. And we'll only use physical visits where that is the best means of gathering the evidence. There's so much that we can do online now or that already exists, but we will come out and visit to gather that the elements that are unique to that as being the best way to do things. And we definitely want to encourage improvement. So we want to make sure that our assessments are capturing good practice and encouraging improvement. We should always be asking, wherever we are, what people are proud of, what they're working on in terms of improvement, so that we can capture that for the important reason of, well, not just celebrating it where we find it, but sharing it. So this whole way of working will have a much smarter way of sharing the outcomes. If I could have the next slide, please. So I want to touch on what we've heard, because we've been developing this work through engagement and co-production with people and partners. And there are a number of themes from that coming through. So partnership working, we're getting the very strong message. CQC, you need to work with other regulatory bodies so that we avoid duplication, and we absolutely are committed to doing that. We can use other people's information so we don't have to come and ask for it again. We've been absolutely this very strong point here that we at CQC must make sure we've got the skills and capability to do this work and the capacity to do it well, so that we're not just piling in additional responsibilities without, we need extra capability to do this, undertake these two important elements of the work, and we need to make sure we've got the right people for that with the right training and support. We need to understand systems. So the feedback we've had is that we should look at a system in its widest sense, and that it'll be important for CQC to recognise the context in which systems and providers are operating. So that might be everything from geography to history to the population landscape, long-running, deep-seated challenges that a system might have. I mean, every system and place has its challenges, but they are different in different places. And we need to really make sure we understand a place as part of this work. And other feedback is that our assessment should focus on addressing inequalities and how a system is looking at delivering, enabling good outcomes at a population level. So we really need to think and be aware of both the issues and what's being done to address them, and really understand that properly. Ratings. So the consensus is that it's too early for ratings. The intention is that there will be ratings both for a system and for a local authority. That is contentious in some places, and that is being debated. But we feel, some people feel, and I think it's a view certainly that I have, having been seen the positive impact of ratings in the provider regulation, is that there is a sense that ratings could be a driver for improvement. The decision on whether or not we rate, the level at which we rate, and when we start doing it and publishing it will be a decision for the Secretary of State in this work, because this is new work for us at CQC, and the decisions on that are for the Secretary of State to make, and obviously we'll be sharing our experience of ratings as part of that to inform that. So next slide, please. I've got another list of things that we've heard. So data, where it exists and where it's robust, we should use it. Absolutely, that's what we want to do, to make sure we're only asking for data where it really doesn't exist. Co-production. So there's a sense that we can play a key role in assessing how well local authorities and ICSs are doing in engaging their populations and developing services in partnership. The best people to understand a service, nobody understands a service like the people who are receiving it, of course the people providing it understand it, but in terms of the insight into how it feels to get that service and whether it could be better or not, you know, it's just so brilliant to talk to people and their families. So we want to see how that co-production is being done. We've had some feedback that leadership can be difficult to measure and some concerns about our ability to measure it. We have experience of leadership has been well-led has been a key question for years now, and we have made that judgment in some very large organisations in the NHS. But we want to really make sure we can do this well, and in this new context that we're being asked to work, there have been some suggestions to consider peer review. Now that's a system that is already well established in local authority work and may well become established for systems, but they're only just very new systems. But we could build on the peer review arrangements that exist. That means bringing leaders from one part of the country to another to help us understand what we're looking at. That sense of being judged by peers is important. Proportionate regulation, there's concerns about how on both the system and the local authority that this work could, the impact that we could have if we're, you know, asking for a lot of information and so on. We need to be proportionate in our approach, and we need to keep that in mind when we're designing and delivering this. Now, there have been some views about how the ratings of providers in a place should interact with the ratings that will be given to a local authority and a system. The strong feedback is that these should be separate and only considered when we're looking at how well a system has responded to the ratings in its patch. As I've mentioned before, about we're interested in how a system supports providers in its patch in terms of improving their service. What it will not be is a simple sum of looking at all the providers across health and social care in a patch, adding up the ratings and coming up with some amalgam. We won't be absolutely not doing that. And we need to be really clear what that interaction is and how we're using it. So if I could have the next slide, please. Let's talk about next steps. So we've got some test and learn exercises. They're not like a full-on pilot that's going from the first to the last on all this. So we're testing elements because there's some things with the work we already do. So for example, we're not testing case tracking because we already do that. We can do it well. We know what it costs. So it's the newer areas that we are testing. We're using the learning from this activity to further refine and develop our approach and to help us understand what we'll need in terms of our team sizes and skill mix to undertake this work. We're continuing to engage throughout this, both with providers and system level leaders, and through attendance at sort of key forums and events. We've also got a special expert advisory group to inform and influence us in our ongoing iteration of this work. If I could have the next slide, please. This touches on the timeline. So for the rest of the year, we will continue to develop, make sure that we've got everything we need in place to deliver our new responsibilities, including recruiting and training staff. And everything at every stage will be underpinned by co-production and engagement. So please do look out for ways to get involved and share your views. We're currently focused on the methodology development, testing and co-producing our approach. The second half of this year, we expect to be focused on what we need to deliver the work and recruitment and so on, but it all needs to be done. and then we start the reviews proper for both local authorities and systems from April next year, which is now 9 short months away. If I could have the next slide, please. This is the slide with all the information about how to stay up to date. Many of you, I think, will all be engaged in our Citizen Lab, but if not, please do join up for that. When you get the slides, you'll have all the links there for the various connections. We'll continue to put information out in our sector bulletins and our blogs, and we keep all our sort of up-to-date news comes through Twitter as well, and through the episodes on our Connect channel. Okay, so I think we have got to the stage now where I'm going to say next slide, please, and any questions. Thank you.
Thanks both. So the first question, and we've had a couple of questions around this, and whether on the local authority assurance side, this is a reintroduction, or will the new process resemble the process that was previously run by the Commission for Social Care Inspection?
It is okay. It is a brand new piece of work based on the Care Act, which came along in 2014. So it's got a statutory sort of basis and focus in a different way to what went on in the past. I actually was involved in that many years ago, so there will be some similarities at a very high strategic level in terms of we're interested in how the local authority understands its population, using its own data, conversations with leadership to understand priorities and how they're doing. So at that level, yes, but that there all resemblance ends. It's got a new statutory framework, a new focus. We've transformed out of all recognition since those days, and we're building on our brand new single assessment framework. So there'll be elements of the familiar, but really it's best to think of it as brand new. That's certainly how it feels to us at CQC, but good question, thank you.
Thanks. And then on the ICS side, so there's a question related to the slide when we talked about the single assessment framework, about whether when we're talking about integrated care systems, do we mean integrated care boards and integrated care partnerships? So I don't know whether there's any clarification over the level that we're looking at when it comes to the ICS side.
Yeah, I'll take that one. Thank you, Sarah. Yes, when we talk about ICSs, we talk about the system in its entirety. So we talk about the Integrated Care Board and how they're partnering with the Integrated Care Partnership, how the ICP, the Integrated Care Partnership, is informing the and driving the agenda of the Integrated Care Board. So we will, when we talk ICS, we talk about those two elements absolutely being hand in glove.
Great, thank you. And then a couple of questions around the kind of the process as well that were asked from the local authority perspective, but I think could probably apply across both. And so that was around how the local authorities or ICSs will be selected, when will they be informed, and also whether visits will be unannounced.
So I'm still live, so I'll kick off. How will they be selected? At the moment, we're not. We're still working through that level of detail as to you know, which ICS we visit first. In April, obviously from April 1st, we're not going to be suddenly charging out and assessing each and every one of the 42 simultaneously. So we're still working through how we'll sequence the assessments, but we will go to all, and we will assess each and every one. Will they be unannounced? No, is the short answer to that, and the rationale behind that is that actually what we're wanting to do is to really use the data to interview key staff, to spend time with key members of both the Integrated Care Partnership and the Integrated Care Board to see how they're meeting the needs of their local populations. All of that takes a lot of diary coordination, and so it's the logistics of it that mean that they wouldn't be unannounced. We will still continue to do unannounced inspections of providers in the same way as we would, responding to risk and concerns as they're coming, as they come up, crossing the threshold, both in and out of hours and in that unannounced manner. I don't know, Mary, if you want to add anything onto that.
Thanks, Mandy. I think you've covered it really well. So 2 years to get this baselining done, to get round everybody in both the system and the local authority. And as Mandy has said, we learnt from our inspections of large NHS organisations that when we're focusing on the leadership part, it really is best to agree to announce when we're going. If a local authority, as some do, have some directly delivered services, those are registered with us separately as locations in their own right, and our approach to them will not change. As Mandy's described, the range of types of inspection and observation visits that we do in places where care is being delivered and received, that won't change, but that would be the only instance in which we would rock up unannounced at something run by a local authority. And we also want to know about things that we might join in on. So if there's, for example, a carers forum or a particular patient group that meets, or a particular sort of community effort or group of staff, we would want to know about that, and avoid duplication of effort where we can. That's probably all I would say on that. Thank you.
Great, thank you. And we'll stick with a local authority question, although another one I think that will apply across both. And this is whether local authorities will receive a rating after assessment.
So the thinking is yes, but the decision on that will be for the Secretary of State. But the way it will work in our new single assessment framework is that we will be scoring the evidence, and this will be the same when we introduce this across provider land as well, that we'll look at evidence and score that, and we will score quality statements, and then the quality statement scores will build to an overall rating. This is a new dawn of an approach that will it will be far easier to look across the country, to look at trends, to look at areas that are going really well, that are providing challenge to providers, systems and authorities. So it's really exciting, the potential that gets. But so when we so let's assume, for argument's sake, the Secretary of State agrees that yes, we will rate, and then agrees when we'll start that from. And it might be we start the work and don't start rating for a little while. These decisions haven't been made yet. But once it's all announced, be very clear, we would be communicating very loudly when this is all going to start from and how it will work. But that is the intention in the new powers that we've been given, that for both systems and local authorities, we will be working towards a rating. And it would be like it is at the moment, you get the work done, you write your reports, they go through quality assurance systems that those who the report is about get a chance to read a draft, and we clear up any matters of fact, and then we publish. Yeah, so it'd be the same format. Thank you.
Great, thank you. And I think last question, conscious of time, and that's around what capacity does CQC have to undertake these assessments / inspections in addition to current provider inspections?
Okay, so this is new work for which we have new resources. So this is work that we've been asked to undertake by the government. So this will be directly paid for. We will get funds from the Department of Health and Social Care. So this will not come out of provider fees. This is separate new work for which we have separate new resources.
Thank you. And I think Charles wanted to come in and add on this question as well.
No, it was on the previous question, actually. It was around the ratings,
sorry,
that we are also exploring that when we do a rating for the ICS, there'll be a direction of travel statement with that rating. So we'll say where that organisation is at that point and where we see them going in the future.
Great, thank you.
And the second point was just to say, I think the funding system is going to be slightly different between the ICSs and the LA assessments, because the ICSs won't be funded directly through grant and aid.
Thanks, Charles. So I think we can hand to Mandy.
Yeah, and I'll just sort of finish on that question around capacity, and then just thank everybody. But one of the things that we've been spending a lot of time doing is changing our internal processes, our IT systems, how providers are going to be able to engage with us, how they're going to be submitting notifications and so on and so forth. So a big driver over the last year or so has been updating our internal processes to enable us to be a really effective and efficient regulator, and part of that will also free up that additional capacity to enable us to undertake this work as well. But we will be building our workforce, we will be building our expertise. We absolutely want to ensure that we've got the right people with the right skills that are undertaking these assessments. We will be going and encouraging people to become subject matter experts, providing us with that additional support and expertise, that sort of critique and to be critical friends and peer reviewers when we are undertaking the assessments. So all of that's going to build into our capacity to enable us to carry on functioning and to continue our work to be an effective regulator of providers, but also now of local authorities and integrated care systems, which is a really monumental shift. So that brings us to the end of the session, and thank you very much everybody for joining us this afternoon and for sticking with us on a very, very hot, sticky afternoon. I hope you found that helpful. The slides will be coming round to you all, and as Mary said, they've all got means of connecting with us. Do look out for ways of connecting, do check out our website, do sign up to Citizens Lab, and do keep an eye out for frequently asked questions that we'll be publishing around all these sorts of questions that you're all asking. So thank you very much for your input, and it's been really great presenting to you this afternoon. And thank you all to Mary, to Charles, and to the team, the backroom team that have done a great job in keeping this going. So wish you all a good afternoon. Thank you very much.